we're excited to share some of the research we've been a part of, and that's also just getting started. So I'll go ahead and jump in with some of the work that I'm exploring around social emotional development. It's really how young children learn to express those emotions from relationships and navigate the world around them. It's that foundation to those big feelings, trusting people, and really feeling safe to explore and learn. What we know from the research is that social emotional development grows through the kinds of nurturing, responsive interactions we talk about in early relational health. And those are those everyday moments between caregivers and children that just really builds those strong bonds. So when we support social emotional development, we are really helping to strengthen that early relational health. And when we strengthen early relational health, those parent-child relationships, we are giving social emotional development the best chance to grow. So another way of thinking about that is promoting social emotional development is really one of the more powerful ways we can support those early health relationships and healthy kids, starting from birth, and doing it in the places where families already go. So that's really important to our work, is thinking about where our families are at. To give you a little bit more context on social emotional development, this definition from 0 to 3 is one that we use in the literature the most. We think about that growing ability to really form close relationships, manage and express emotions, as well as explore and learn. And that's all, again, within that context of their family, community, and culture. So it's not just one thing, it's really social emotional development. It's that whole set of skills that really grow through everyday interactions, really grounded in that foundational relationships that those kids have. And then it's shaped by the culture in which our kids and families are being raised. So a little bit about the project that I'm starting to work on. This is the pyramid model. Some of you may be familiar with this model framework. It's been in the early childhood education field for many years, lots of research around it on promoting social emotional development to really reduce challenging behaviors through positive relationship-based strategies. As you can see, it's built on 3 tiers. Universal supports for all children, followed by targeted strategies for those who just need a little extra help, and then really that intensive individualized intervention at the top of that pyramid model. What's most important here is how this model shifted the field. So with the pyramid model in education, we've moved away from reactive discipline and really moved towards proactive, developmentally informed practices, really grounded in connection to build those relationships, and also co-regulation. So we see a clear alignment between this framework and the goals of early relational health, especially in those bottom 2 tiers, universally, and then for those kids who just need a little bit of support, where those nurturing caregiver-child relationships are the focus. We have decades of research that shows us that these supports reduce suspension and expulsion in preschool, improve emotional regulation, and strengthen caregiver-child relationships. But as I mentioned, most of this work has been done in the classroom setting. So I'm working on a proposal to adapt some of these evidence-based practices for primary care. So in the pediatric primary care settings, and really thinking about creating a public health ecosystem of early relational health and interventions. We plan to equip pediatric providers with tools and information to support families in building these skills early and to recognize when additional help may be needed. Families already look to healthcare providers for guidance, especially in those first 5 years, and so we want to meet them there with those tools that really work. So here's the heart of our proposed project. We're taking the proven strategies from the pyramid model in early education and then bringing them into that pediatric primary care setting. We really want to train providers, and that includes a whole clinic, including your doctors, nurses, any support staff, to do 3 big things during those everyday well child visits. promote social emotional development with all families, prevent concerns by strengthening relationships early, and partner with families through open, strengths-based communication. So just like what we've done in the classroom, the key is really to being proactive, relational, and developmentally grounded. This diagram kind of shows the vision that families, providers, and communities are working together, all within that early relational health framework. By aligning these pyramid-informed strategies with existing pediatric workflows, we really believe we can make a meaningful impact, especially for families facing barriers to access or support. So to give a preview of what we're thinking about in terms of the intervention, we want to ensure families and providers have simple, practical tools that they can use every day. So we are thinking about developing a community toolkit that will include things like flyers, posters, cards that can be shared with families up on the walls for people to see that have that clear language and visual cues. Think about like a clinic lobby or a library, even the grocery store. These are co-designed with families to ensure they feel relevant, respectful, and also easy to understand. The second piece that we'd like to develop is a texting campaign, a low-cost, high-reach way to share short strategies with families right on their phones. The idea is to really provide regular, developmentally grounded tips like how to name and validate emotions or how to set up soothing routines. We can also include prompts for parents to talk with their providers when it's time for that next appointment, creating more opportunities for the real partnership during well visits. We're hoping that together these tools can help move social emotional development and early relational health from something we talk about occasionally to something families really live, see, and feel supported in every day. So here are some, I've got some key resources, but before that, some ways for you guys that are on the call today to think about being involved. I think a big piece is really starting that conversation. So using feeling languages in everyday work that you do with families and young children to support that social emotional development. Be a thought. We'd love feedback from our partners. So if you're interested in this and want to be a thought partner, we'd love to connect with you. Staying connected, I have some resources for you to do that. So you're in the know of kind of what's going on. And then sharing your voice, what would support you in promoting social emotional development in your setting. So thinking about the context in which you work, how can you bring this information to your colleagues, families, and the young children that you support? I'm going to wrap up with a few resources, and I know Christy has shared with us that these will be sent to you afterwards. So I encourage you to check out the pyramid model resources on challengingbehavior.org. They have a wealth of information and resources around social emotional development. Right now, it's more education-based, but it's all applicable and usable for anyone working with young children. The second resource is the CDC's Milestone Tracker app. This is a great resource for families with young children who want to monitor their child's development. It's a really good tool for engaging providers when you go in for those well child visits by completing the questionnaire before, for example, like the 15-month visit. You can share that information with the provider and really build their knowledge base of where your child is developmentally. And then the third one, the Center on Developing Child at Harvard, they always have the latest research around development and how we can best support those early relationships.